Hello, everyone. Today we will discuss some terms that seem quite confusing to some of you: efficiency, efficacy, effectiveness, and productivity. These terms are often used interchangeably, but they have distinct meanings. Here's a breakdown of each with a special focus on the context of healthcare settings. First, efficiency is the ability to achieve a specific outcome with the least amount of resources. In the healthcare context, it means using the fewest resources, such as time, money, staff, and equipment, to deliver a particular service or achieve a specific goal. For example, streamlining patient check-in procedures or optimizing medication dispensing systems. Efficacy, on the other hand, is the ability of a treatment or intervention to produce the desired outcome under ideal conditions. We can then say that it is the proven ability of a drug, treatment, or procedure to work as intended in a controlled setting, often through clinical trials. For instance, we can mention here the efficacy of a new vaccine in preventing a specific disease. Effectiveness refers to the ability of an action, an operation, a treatment, or an intervention to produce the desired outcome in real-world conditions. Within healthcare settings, it is the extent to which a treatment or intervention works as intended in a clinical setting, taking into account factors like patient adherence, comorbidities, and healthcare system limitations. For example, the effectiveness of a diabetes management program in improving patient outcomes in a primary care setting. On the other hand, productivity can be simply defined as the output or the results achieved per unit of input or resources. Within healthcare organizations, it refers to the amount of work or output, such as patients treated or procedures performed, accomplished by a healthcare professional, a healthcare provider, or a system relative to the used resources like time, staff, and equipment. For example, the number of patients a physician can see in a day, or the number of surgeries performed per operating room. In summary, efficiency is about minimizing waste and using resources wisely. Efficacy is mainly about the proven ability of a treatment or intervention to work under ideal conditions, whereas effectiveness is about how well a treatment or intervention works in real-world settings. Finally, productivity is about the output achieved per unit of input. A simple example in a healthcare setting to illustrate all of these is the case where we have the implementation of a new electronic health record system in the organization. This system might be efficient if it reduces paperwork and improves data entry time. It might be effective if it leads to improved patient care and outcomes. It might be productive if it allows healthcare providers to see more patients or complete tasks faster. However, its efficacy would need to be established through research and clinical trials. Thanks for watching. Like, share, and comment. See you soon for another video. Carpe diem.